Good morning. My name is Adrian Johnson, and please forgive me for looking the way I'm looking. I just got in at 2 in the morning. I'm currently on a contract in the mountains. But right now, I'm going to read aloud about nasal medications, nose drops, and nasal spray medication administration. At the completion of this model, the student should be able to administer nose drops and nasal spray. Perform skills in general medication administration checklist. Clean hands. Position client correctly. When doing drops, assist clients to sit or lay down with head slightly tilted back. Be sure to not have the client tilt their head too far back to avoid neck injuries or pain. When doing sprays, have clients sit up. Warm nose drops by holding the bottle between your hands for a few minutes before giving. Remember to put on clean gloves. Administer the correct amount of medication. With the drops, put in order number of drops. Instruct client to stay sitting or lying down for a few minutes. When doing sprays, administer order number of sprays. Spray quickly and forcefully squeeze the bottle while client sniffs. The client can do this himself or herself if he or she is able. Wipe dropper of spray nozzle with a tissue. Replace and tighten the cap. Store medication bottle accordingly to agency policy. Then remove gloves and discard according to agency policy. Clean hands. Provide the right documentation. Administering inhalant medication. At the completion of this model, the student should be able to administer inhalant medication by meter dose inhalant and nebulizer. The key points are depending on agency policy, inhalant medications may be given by a licensed nurse or a respiratory therapist and not by the medication aid. It is important to follow your specific job description and the agency's policies and procedures. Medications given by inhaler are inhaled into the lungs and absorbed there. In order to get into the lungs, the medication must be in a mist or inhaled deeply. These airborne medications can be delivered by a meter dose inhaler, MDI, a nebulizer, atomizer, or a disc. A The MDI and disc delivers a present dose of medication when the client compresses the canister or releases the trigger. It is important for the client to use the device as instructed and to inhale deeply and evenly in order to get all the medications into their system. If the device is not used appropriately, the medication just ends up in the mouth or on the face. Several different medications can be delivered by inhalant. If more than 1 meter dose inhalant is needed, the sequence and the number of puffs for each will be indicated on the MAR. Also, the time between puffs and between different inhalers, if applicable, should be clearly stated on the MAR.